Hi everyone, my name is Claudia Schuchart-Peet and I am here with Christina Kirchie. And first of all, we're really excited and thank you for giving Christina and I the opportunity to share our proposal for a serious game. We're very excited about the possibilities for implementing serious games as another way to involve the library in educating our nursing staff to meet the mission of the hospital in providing excellent care to our patients. So why are we considering serious games? We're all aware that the acuity level of our inpatient populations is rising. Today's patients not only have a chronic illness, but also often have additional comorbidities that make their plan of care more complex. In a 2013 Nursing Education Today article, it stated that the top 3 reasons for adverse patient outcomes include failure to properly diagnose, failure to institute a proper diagnosis, and inappropriate management of complications. Our serious game proposal will address the last 2. While physicians often provide the diagnosis, we know that our nurses are the primary caregiver for the patient, and they spend much more time with the patient, continuously assessing their care. Nurses are also usually the first to detect problems which may require quick action. Within the past year, we have seen the retirement of many of our experienced nurses. And when they leave, they take with them years of knowledge which enabled them to quickly intervene when a patient deteriorated. We have also replaced many of those experienced nurses with new graduates. While these graduates possess the foundational nursing skills, they are often not adept at critically thinking to react quickly and appropriately, sometimes very scared about how to utilize the resources, or really not understanding how to utilize the resources or ask for help. I just talked to our critical care clinical nurse educator, and she said studies state that it takes about 5 years for a critical care nurse to become very adept at what she's doing. And that many of our new graduate nurses are not staying for those full 5 years. Part of it because they just never feel comfortable in a critical care setting. It's almost like baptism by fire. So the serious games will enable the nurses to gain the experience in a structured, safe, non-threatening environment, developing their critical thinking skills and information literacy around hospital databases and resources. This will provide them with a simulated experience that will hopefully give them the tools and expertise they need to quickly react and, most importantly, feel comfortable when they come to work because they're doing really the best job that they can. So a lot of you are saying, okay, she keeps talking about a serious game. What is a serious game? Well, it's called a serious game because it is designed for a purpose other than entertaining the game player. Although many serious games have both factors which we want to also incorporate. Serious games have been used in the defense industry for decades and is being looked upon as a great way to provide professionals in different environments with virtual experiences that increase their skill level. In fact, more and more it's being contemplated to use it actually in education and in healthcare. Decision making is a process, and we know that. Nurses, so when we make decisions, we go through all the steps. And nurses also have to go through all those steps. So they have to consider the situation, collect cues, which would be like patient data. They have to process those cues, identify problems and issues, establish goals, take action, evaluate, and reflect. And many of you are familiar with Bloom's taxonomy, so I'm going to use that. Knowledge is kind of our foundation. of comprehension. However, what we have to do is we have to take that knowledge and actually apply, analyze, and synthesize that. In a critical situation, like in a clinical critical care unit, the entire process sometimes has to occur quite quickly. And I'm sure you've all heard a nurse make a statement like, as soon as I entered a room, I knew something wasn't right. Experience is valuable because it enables the nurse to sometimes detect complications and intervene to prevent further complications because it starts to become intuitive. In other words, they had a gut reaction, knew precisely what to do, and did so immediately. These nurses who have these gut reactions need fewer guidelines and procedures to develop an outcome. It's because they've had practice. So our idea for the Serious Game, our plan is to guide scenarios so accessing this cognitive knowledge and reacting becomes much more intuitive and allows the nurse to feel more comfortable. So our idea is that nurses will come down to the library where they will get an iPad, which will have the game loaded onto it. They will then sit at a desktop. The game will begin with a shift scenario, and each nurse will have a typical 2-patient load at the start of the shift. He or she will have access to patient records, which we will have placed in Meditech on the desktops. And she'll also have access to, of course, all the hospital databases. As the shift begins, his or her patient load may increase with an admission, which could, even though it's maxed out at 2, sometimes when we have patients who are a little bit in between, we have to, up the number of patients that they have to 3. So again, we're trying to make it realistic. So the load may increase with an admission. They may experience a code of some type, family problems, sudden change in patient vital signs, so it all depends. And as the nurse progresses in the game, scenarios will become more complex. By accessing Meditech and the hospital databases, the game again will be much more realistic. In our research, we also realized that serious games can be stressful, so our goal in creating the game is to incorporate interesting graphics, music, physical movement, humor, and narrative, and try to really work at addressing multiple intelligence elements. Ultimately, our goal is we want nurses to enjoy the challenge and fully engage in the game so that they gain mastery of skills with the end goal of the nurse developing a strong sense of self-efficacy through the development of critical thinking skills. Practice is important. Practice because we know cognition is neither purely intuitive or analytical, but a combination of both. And with that, I'm going to hand you over to Christina, who's going to tell you how we're going to implement that